I'm Ami Banerjee. I'm a cardiologist and an academic at the Institute of Health Informatics at UCL, and I lead the Doctor as Data Scientist module. So innovation and technology are both overused terms probably. They mean slightly different things. Innovation means anything that's new that can be used to, for example, change a pathway of a patient, a treatment. It could be a new IT solution, whereas technology is an advance in science that could be actually an old technology, such as machine learning, which everybody's talking about now, has been around since the 1950s and 60s in actual fact, but it's just that technology is advancing more quickly. But technologies include drugs, devices like pacemakers, and also include more digital devices and technologies such as wearables, such as apps on your mobile phone, for example. So digital health and digital health technology are words that have become very frequently used, and they're very loosely defined actually. It's difficult to find a definition. I think digital health technology has been mostly used to mean things like mHealth, which is health applications around mobile phones, or so-called e-health, which is more electronic health that includes mHealth. That might be via your computer or other electronic devices, but it also includes the IT infrastructure. It includes health and wellness as well as disease, and I think it also signals a different way of doing things to the standard delivery of care and the way we've treated and prevented disease. And I think it is different in some ways, in terms of its scope, in terms of the pace of advance, but there are things that are very similar, that it could also be viewed as eventually being responsible for treating or preventing disease, so we have to view it through the same lens. And of course there's overlaps as well, so some digital health technologies are also medical devices, such as pacemakers, for example. So we have a set pathway for testing and reappraising and regulating medicines through what are called phase 1, phase 2, phase 3 trials, and we have bodies like NICE to do that. We also, at national and European level, have regulations for medical devices, whether it's wheelchairs, whether it's condoms, whether it's hip replacements. We're still figuring out how we should be testing and evaluating and regulating digital health technology. At the moment we have guidance and we have stakeholders coming up with what might be reasonable in terms of the evidence required, but at the moment we don't need clinical trials in the same way, and I think that this is a space where to protect patients and also to guide us clinicians, that there's a need for better guidelines and clearer pathways of evidence, so that we can use these devices and technologies safely.